Tonight on KQED Newsroom, a major effort ramps up in San Francisco to track and trace new coronavirus cases as testing sites expand in the Bay Area. Plus, federal relief dollars flow once again to small business owners and nonprofits struggling through the crisis. But will those who most need the help get it? And we connect with a Stanford scientist testing novel ideas for masks and other protective equipment in the global fight against the coronavirus. I'm Priya David Clemens. Hello and welcome to KQED Newsroom. It's week 7 of sheltering in place in Northern California. We're continuing our ongoing coronavirus coverage. This week, the U.S. surpassed more than 1 million cases of coronavirus, and more than 63,000 people have died from COVID-19, the disease caused by it. Also, 6 Bay Area counties announced this week that their shelter-in-place orders are extended through the end of this month. Meanwhile, testing is growing, and public health officials are now focusing on contact tracing as a second vital phase to contain the virus. Joining us now is Dr. George Rutherford, a UCSF epidemiologist and advisor to San Francisco's Department of Public Health, who's leading the contact tracing program that started this week in San Francisco. Dr. Rutherford, thanks for joining us again.
Thanks very much for having me. Pleasure.
We'll get to contact tracing in just a moment, but first I'd like to talk about some breaking news today. The FDA has authorized emergency use of remdesivir, an antiviral, to reduce the mortality and duration of COVID-19. It has been proved to do this in some studies, although there's been one that was negative. Tell us your thoughts about remdesivir and how quickly it can be utilized in the population.
I think it's a great step forward. The fact that there was a negative study from China doesn't really bother me very much. That study didn't really have a lot of power didn't have enough people in it to really get the effects, to understand exactly what the effects are. The effects of this drug are relatively modest, I'd have to say. This doesn't reduce mortality from 11% to 0 or anything like that, but it's a start. And just think of how the AIDS drugs started, the antiretrovirals. First we had AZT, then we added other drugs to it, and we added other drugs to it. And all of a sudden it became a curable or at least treatable disease. So I'm actually quite encouraged by this, and I think we're going to use it as fast as we can get our hands on it. UCSF has been using it a lot in clinical trials, and I think it's fairly straightforward to switch over and start giving it to the patients for whom it's indicated.
There was also encouraging news out of Oxford University this week saying that they are about to start testing a vaccine for the coronavirus. Is this cause for optimism?
Yeah, of course. The more vaccines we have in the pipeline, the better. But understand that we have to get through human trials, and we have to show that it works in humans, A, and B, we have to be able to know that it's safe to use in humans. So I think animal studies are great. It's a stride forward. But, it's still a ways off.
Let's talk about our perspective here in the Bay Area, where it seems we have been flattening the curve. And if we're doing such a good job here in the Bay Area, why is it that stay-at-home orders have been extended for another month when other parts of the United States are starting to open up again?
Well, I think we know something that they don't, which is that this is a deadly virus. And, we've managed to avoid massive mortality in the area. And we're going to take a measured approach to coming away from shelter in place. And I think that the governor and the boards and the mayors have done the right thing by extending it and by slowly backing down from it. As you know, the new order that will go into effect on Monday allows for construction to start back up again. I think we'll probably see incremental changes over time, and other things will get going again. And that's, that's the right way to do it, rather than flipping a switch and saying everybody can go do whatever they want.
We've moved into a second phase, which is contact tracing. Tell me about the contact tracing work that's being done right now in partnership between UCSF and the city of San Francisco.
So the Department of Public Health is a terrific contact tracing program that we've been able to supplement and add people to. We've also been able to create training materials, a supervisory structure, so that we can bring in lots and lots of extra people to do contact tracing, which is what you need to have to do it properly. The city has a core of disease investigators who are highly skilled, highly trained, but it's a core. It's a finite number of people. We've been able to augment it with people originally from UCSF, then from other city departments like the city attorney's office, the assessor's office, and the librarians, and then with a bunch of other volunteers, our own medical and nursing students, as well as retired nurses and physicians from around the city. So that's a big core. So we're really running now a group of about 150 people to do this, which is what you need to do to make this, to really give it the degree and level of attention that it needs to have to be successful.
There has been some limited contact tracing that's been happening already. What's different about this program, and is it the first of its kind in California?
This has actually been going on for a couple of weeks, and it's it's the most comprehensive one going on in California. I think other counties, at least initially, had done some contact tracing as the first cases came in, but ours is really the one that's pushing the envelope here as we get deeper and deeper into the epidemic, and as we start to come down on the curve. You have to realize that in life post shelter in place, contact tracing, isolation, quarantine, case finding are going to be the major tools that public health is going to use to control transmission and by controlling transmission to keep mortality low.
When you say we're pushing the envelope, what does that mean? Are there more people who are doing the testing? I know that they're not all healthcare professionals. People from various backgrounds are being trained to do this work.
Right, it's great, and we've had an outpouring of support from across the city. We have UCSF employees, we have city employees from the non-healthcare, non-social service agencies like the libraries and the city attorney's office and the assessor's office. We have volunteers from retired physicians and nurses, from our medical and nursing students, all who are trying to pitch in and make this go. It's a lot of people. I mean, we've trained a couple of hundred people, and we have 150 working on this. We're taking shifts and actually working on contact tracing. So this is a huge effort. In a comparable county, they might have 2 or 3 people doing this. These are the kinds of numbers you need to successfully control this after we come away from shelter in place.
Before I let you go, I do want to ask you about testing. When you were on the show last, you were talking about how the Bay Area is ramping up testing, and I think you'd hoped at this point that we would be further along than we are. Can you tell us where we are in testing and how many more tests we need to get to a place where you'd feel comfortable?
Right now in San Francisco, we're in good shape with testing. Yes, we have temporary shortages of swabs. We have temporary shortages of transport media and reagents and things, but we really have capacity here, and it's really due to the generosity of the Chan Zuckerberg BioHub and our graduate students from UCSF. We're basically staffing a clinical laboratory there. They've repurposed a research laboratory into a clinical laboratory. That's why we have the capacity. We've extended that capacity to the other health departments in California if they need to use it. So that's good. There's still, I think, a little bit of hesitancy on the part of providers to use testing. There's a kind of siege mentality still, and that's what we're trying to bust through now to tell people, yeah, you can come get tested. Yeah, come on down. Yeah, we can help. We can accommodate you if you want to screen people at a nursing home, for instance, whatever you'd like. If you want to screen people in a homeless shelter, we have the capacity to do the testing.
Dr. Rutherford, 6 months from now, how do you think our lives will have changed here in the Bay Area and beyond from the coronavirus? Will we still be wearing face masks?
I think so, unless a vaccine comes along very quickly. That's only November. I think if you ask where will we be 12 months from now, I think we'd be in the middle of a massive vaccination campaign. Right now, if I were to polish up my crystal ball and look forward, I think what we may be worried about in the fall is a second wave of transmission as kids come back to school. We don't really quite totally understand the dynamics of that. And I know a number of groups, not including ours and Stanford's, are going to be looking at that as well, to try and really get a feel for whether schools are a big amplification factor as they are for influenza A.
Dr. George Rutherford, thank you so much for being with us again.
Thanks again. Pleasure.
This week, the Small Business Administration started accepting applications once again for the Paycheck Protection Program. intended as a lifeline for small businesses and nonprofits struggling to survive. Congress recently approved an additional $310 billion for the program after demand far outstripped available money in the first round of funding. Joining us now is Avital Unger, the founder and owner of Avital Tours, who recently received funds through the program, and Randall Leach, the CEO of Beneficial State Bank, an Oakland-based community lender that has helped more than 900 applicants get PPP loans. Thank you both so much for joining us.
Thank you, Priya.
Randall, Beneficial State Bank is a community-oriented bank. Tell us about the type of client you typically serve and about the type of PPP client you're seeing right now, their average loan ask.
Sure. So Beneficial State Bank, we're a community development financial institution that focuses on the underserved. So we've been doing this a long time. The PPP program is very different, though. We've seen over 2,000 inquiries over just the last few weeks for this program. So as you mentioned, we've approved over 900 loans today. So about 1/4 of those are to women-owned businesses or businesses owned by persons of color. About 1/3 of them are to nonprofits, and about 87% of them are mission aligned. And typically these are very small businesses and micro businesses. So over 2/3 of them are to businesses with less than 20 employees.
You've noted that the government's guidance on this program has been piecemeal and ambiguous. Tell us more about that experience.
Well, it's been very well intentioned to be able to implement these policies and these programs very quickly because of the urgent and the dire need that's out in our communities. But with any massive scale program like this, there's challenges. So going into the opening day, we did not have all the information to be able to actually set up a loan program that you'd expect. Very fundamental questions were unanswered, such as what should the loan documents look like? How does this forgiveness process work? So there's a number of factors that they had to update us every day and sometimes multiple times a day just to be able to give us the direction of how the program was intended to work. And then while that's happening, we had to build systems to be able to handle this tidal wave of loan applications that were coming at us.
So you've been working literally around the clock, I understand, for the last several weeks. So let's move to Avital, about Avital Tours. You've run that business for 9 years. You started it. Tell us about Avital Tours and how it's been impacted by the coronavirus.
Oh, wow. Well, we were one of the first companies to see the effects of coronavirus, being at the intersection of both corporate events, travel, and food. So, my company is a food tour company, and we were doing corporate team building, people entertaining clients. So when tech companies started having work from home or no longer flying their employees in for, in-person events, we started to see the effects and our revenue drop to zero.
And you applied for a PPP loan. You got the amount that you asked for, $83,000. What does that money mean for your business?
I mean, it's a lifeline. It's absolutely, it can be the difference between life or death for a business, especially small businesses like ours. So it's 2.5 months that allows us the cash flow to be creative and be able to think about new business models as we continue. We have already pivoted to virtual culinary experiences, offering virtual mixology and chefinars, taking our bartenders and our chefs online to be able to offer experiences. But in the next phase, we are absolutely going to need to be creative in terms of reinventing our company and continuously finding ways to stay relevant.
Now, you did have to let go of some of your employees earlier with this PPP money. Are you bringing people back? How is this working for you?
Yes, absolutely. So, it's absolutely intended to be able to rehire those employees, and we are, now that we have just received the funds, we are actively trying to bring more people back on to help our business. And it's been incredible, actually. Our virtual business is going well, and so we actually need those employees to come back in order to be able to serve the clientele that we now have.
That's great to hear. Randall, do you expect the money that's been allocated for small businesses to go to the intended recipients in this second round?
In the second round, we do hope that it does. I mean, I think there's challenges with the whole size of the program and the actual amount of reach it has. in our view, there's just not enough money to go around, right? So we're pushing today. We expect to be able to hit about 1,000 applicants where we were able to approve their loans, but we had over 2,000 inquiries. So we're not done. We think that that's representative of what we see with other banks. So but what we are seeing is that it is going to smaller businesses. So for example, the loans that we have funded so far reflects paychecks for about 16,000 employees. So we're a small bank. That's a big number, but it's not big enough, right? So where we are right now is, it's basically, it looks like there's not enough life preservers to go around, right? And so there's been this initial panic and rush for folks to get their applications approved, excuse me, in that first round, and we see that continuing.
And that's one of the interesting things about this program is that it really has been sort of a race to get your application in before the money runs out. Avital, what's that been like for you?
Oh wow, it's like sprinting a marathon. It was absolutely a lot of work, especially as a small business with incredibly limited resources. I put applications into 3 different banks, and was able to receive it through one of them.
And Randall, I know you've done as much business in the last few weeks as you did in the previous 4 years. Despite the wrinkles in the program, the PPP program, do you think this is the best way to get money quickly into the hands of those who need it most? Or would you say there should have been a different way of doing this?
I think it's a very effective way, but again, it's not enough. I don't think the size of the loan is enough. It's enough to help businesses have an option to restart, but not necessarily have enough to get them to be able to get back on their feet and stay there.
What would you say the amount should be?
Well, I think 6 to 12 times their payroll, for example, right? And maybe all of that's not forgivable, that they have a chance to pay it back over a 10-year period or something. But really, that this is a very small window of forgiveness. So what we're seeing is that go back to that life preserver analogy, is that folks are panicked and they're rushing to get it. And so we get it to them, and then they realize, okay, wait, I have 8 weeks of payroll that this will cover. I may not be able to hire my employees back. They may not be able or willing to come back. I might not have my clients come back. So if this is all I get, how am I going to restart my business? And so they're holding on for dear life right now, and they're terrified to jump into the water because they know it might not be enough. They may not make it to the other side. So we absolutely need more tools than what we have at our disposal today.
And Avital, I'm going to give the last word to you here. What advice would you have for policymakers who are looking to help nonprofits and small businesses who are struggling to survive?
More resources. We're entering a new phase, and I think that unemployment is one way to go, but I would have loved to see this come before I even had to lay off employees. I think that there could have been a lot more resources up front, but now that we're in the position that we are, let's try to help small businesses who are the cultural blood of cities. I mean, small businesses, not big businesses, are the ones who are going to bring the arts, the culture back into society. So let's make sure that they have the resources to be able to still be creative.
Avital Unger with Avital Tours and Randall Leach with Beneficial State Bank. Thank you both so much for joining me.
Thank you.
Thank you for having us.
We should note that KQED is among the local businesses and media organizations that have received a Paycheck Protection Program loan. In just a few months, the fight against the pandemic has revealed an alarming truth. There just aren't enough masks, gowns, and goggles for the army of health workers trying to save lives while avoiding infection themselves. So Stanford bioengineer Manu Prakash is engineering novel, quickly scalable solutions to this global problem. In his lab, off-the-shelf snorkel masks are transformed into protective equipment with an air filter to keep out virus particles. Unlike traditional respirators, the prototypes can be reused for up to 28 days and are easily disinfected. Prakash and his team also found inspiration in a cotton candy machine, hacking and retooling it to spin N95 grade face mask material quickly and cheaply. Joining me now is Manu Prakash, an associate professor of bioengineering at Stanford University and a 2016 MacArthur Genius Grant recipient. Manu Prakash, thank you for joining us.
Thanks for having me.
Let's jump right in and talk about the face mask that you've created here. It's an adaptation of a snorkeling mask. Tell us how you got started on this design.
I was just returning back from a trip from France around March 10th. Some of the work that I do as a lab is in marine biology, and I was starting to see the shortage that I saw in Europe and thinking about that we're going to be hit with the same situation right here. And around that same time in quarantine, literally sitting in this room itself, I started realizing
that we have... You were quarantined.
That's correct. Yeah, I was quarantined because I just returned from France, and then also wasn't feeling that great actually for some time. And
did you, excuse me, but did you end up being? Did you end up having the coronavirus, or was there some other health issue?
No, I had all the classic symptoms. I did get tested, and I tested negative. I spent a day at the hospital, but I think it passed eventually. Yeah. But on the other hand, I think what I've felt around that time, and being at the hospital and watching the doctor and how many number of times they threw their PPE away while they were taking care of me, every single time they entered, every request I had, they had to come in the room with a fresh PPE. I started thinking about reusable PPEs, and in the context of what are called elastomeric respirators. And of course, we had to come up with a solution that depends on something that's already in the supply chain, because the shortage is a supply chain problem. And that's when we started building on the idea of using full-face snorkel masks that could be adapted to the challenge, combining it with viral filters that are already accessible to hospitals and are in their medical supplies to enable a full-face PPE solution, which would be an alternative if no other PPEs are actually available.
Could you show us what this sort of looks like?
Yeah. So, I think many of you who have been out snorkeling have actually used these types of full-face masks. The history of these go back to some of the PPE solutions in elastomeric respirators itself. And one of the interesting bit here is this is actually the original one of my own masks. There is a little coupler here, a space to be able to attach different components to it. And this was the starting point. We partnered with Boston Scientific and several other manufacturing partners to build injection molded couplers, and partnered with filter manufacturers that make these filters for anesthesia machines and respiratory circuits, which is already a pre-approved product from a context of viral filtration. And the combination of these three components, a filter, a coupler, and a snorkel, is what really turns it into a protective layer for the healthcare workers.
And you've been able to actually get some of these prototypes out into the field. Where have you sent them, and what's the feedback been?
Yeah, we shipped out the first sets of components for feedback all across the country. At this point, we've roughly shipped around 1,600 of these units across, with another 1,000 leaving in a day or two. We have focused quite a lot on the New York and the Miami area, but one of the ways that we are starting to get these out to people is to think about an equitable way of distributing these. So we have a clinical form that anybody can fill out on newmask.org, and we compare it to the number of cases in different counties that we are starting to see. So if you go on this website, you can see a global map. Of course, we have international partners as well, but for the current distribution, it's primarily focused on the U.S. And, the joy in doing this work has been interacting with clinicians that have been so passionate. I mean, both engage with us technically. So this is not just our work. We have enabled essentially a group of individuals that come together. And many of these clinicians had been thinking about these ideas, and we've started to bring scientific rigor to these ideas. So I almost feel like it's been a big family trying to put these solutions out in front of people.
So let's move now to another device that you've been working on. You started with a cotton candy machine, and you're using it to spin N95 grade masks for face masks. Tell me how this works.
So I think everybody knows they're at this point now with the N95 masks that look like these, that we have a shortage of them primarily because of the melt-blown polymer that's used inside it. Melt-blown already implies that there is this process that's used at large scale, things like 3M and many other manufacturing and vendors that would make these polypropylene materials. And that has been a bottleneck. And we started thinking about it from a perspective of not just right here, but places around the world where this pandemic has not as yet reached, thankfully, but will eventually reach, where there is absolutely no resources of thinking about getting access to an N95 material. I was talking to a doctor friend of mine in Bangladesh where she relayed to me that many hospitals have never even heard of N95 because it's just not accessible. And we started asking ourselves, rather than centralizing facilities that manufacture these, which can't scale, could we think about a small-scale distributed manufacturing for these high-grade materials, which could then combine with testing and quality control locally? So imagine thousands of factories springing up that are producing 1,000 to 10,000 high-grade masks. That would actually be equivalent to 10 million masks per day. And the context of cotton candy is, as a kid, of course, I've enjoyed eating cotton candy. But if you think hard about it, what a cotton candy is, it melts the sugar and it spins it centrifugally in a way to generate fibers. And we've been able to demonstrate technically in the paper that we just posted on Archive that not only can we generate a material that has the capacity in equivalence to what an N95 material is, we are working on ensuring that the breathability of this material would be the same. So it's still a work in progress, but it has promises which has me very excited.
Well, it seems fascinating, and we are going to be keeping up with you. Manu Prakash of Stanford, thank you so much for being with us.
Thank you. Thank you for having me.
To find out more about the New Mask Project, go to newmask.org. As always, you can find more of our coverage at kqed.org/kqed-newsroom. I'm Priya David Clemens. You can reach me through my social media handle, Priya D. Clemens. Thank you for joining us. Stay safe.